Hi guys, my name is Karen Dees. I am the Marketing Manager for Patient Concierge Services. And for those of you that don't know who we are and what we do, we provide a full wraparound service from organising your surgical appointments, as well as chaperoning you throughout all of your appointments and providing the aftercare. And part of our service is getting to know the choice of surgeons that are available in Bali. And today we are here with Dr Indra.
Hi guys.
Who works at BIMC Hospital Cosmetic in Nusa Dua. And we just want to get to know you, get to know your area of expertise. We've got a few questions lined up. And for anybody that's watching, I think you have like a 4-month wait list at the moment. Is that about right?
Really?
Yeah, I think so. Yeah. When we chat with the admin team, there's a little bit of a wait list. So you definitely seem to be more up and coming and more in demand.
Okay.
Yeah. So what drew you to become a plastic surgeon?
First of all, thank you for having me. Patient Concierge Service is my pleasure. It's really a big step for me. And regarding that question, so first of all, I was raised and born in a Balinese culture. Like my hometown, it's called Sukawati village, so it's famous for the art market.
Art market.
So since I was kids, my family was very into a Balinese art.
Okay.
And my grandfather told me to draw. Actually, my grandfather are one of the artists. He is a painter and sculptor. Also did the Balinese dance.
Oh yeah?
So
like performance?
Yes. So I inspired by him, and then he used to teach me to paint, stuff like that. So I kind of into the art.
Okay.
And when I grew up, I really see that the medical field, it's the art itself. So I remember when one of my mentor, one of a plastic surgeon, told me to stitch. And it was like a very bad wound on the face.
Okay.
It's very bad. And then he just stitched it, and then suddenly it was like nothing happened. So
really?
Yeah.
Like a reconstruction?
Yes, that's correct. So that's the time I really amazed with this field. So I decided to go into it, and I'm glad that I'm in. First, I was joined the plastic surgery residency program on 2019.
Okay.
And 4.5 years experience in the residency program, and I finished end of 2023.
Okay.
And in 2024, I start my career as plastic surgeon.
Wonderful.
So,
and how long have you worked at BIMC?
Now it's my 2nd year, I think.
Yeah? Has it gone fast?
Yeah. It's really, I can imagine that. I'm right here with a lot of patients. I'm also thanks to BIMC and you PCS team. So you guys are amazing to bring the patient. So maybe a lot of people doesn't know us because different country, for example, but with your help that we can connect with the patient.
Yeah. It sounds like you have a natural flair for creativity. You come from your family, and it's kind of been part of your genes. And I guess as a surgeon, you take something, that's already beautiful, and you make it even more beautiful when somebody wants a refreshed look.
Yeah. So I believe in plastic surgery. It's not about a perfection. It's more to improve. I also have one side of mine that it's all about balance. My principle is, we as a human being, we need to be balanced with the divine, the creator, interaction with other human being and the nature. So I keep that principle with mine. So even in my practice, I keep that principle. And because I believe when the balance is there, the harmony is there, the goals will be like more than it should.
I like that. So it really that really highlights your ethics, and your morals, in terms of you're not looking to change somebody's appearance, you're looking to preserve, enhance, and slightly improve. So that says a lot about you as a doctor as well. So thank you for that introduction.
Yeah.
So one of our services, Patient Concierge Services, is we really specialise in understanding somebody's emotional journey throughout having cosmetic surgery. And most of our clients are over the age of 45, usually over the age of 50. They have been dancing with the decision for a little while, whether they should or shouldn't. And that can come with lots of different feelings like guilt, confusion, conflict, and sometimes they don't tell other people, because they're a little bit embarrassed of what others might say, like friends and family, the reaction. And for some reason, the media usually only ever gives bad stories. And I think there's a reason for that. I think the reason is there's a really long spectrum of what's unethical and what is ethical in terms of when is the right time to have plastic surgery. So from your perspective, because I'm not medically trained, but from your perspective as a surgeon and as a doctor, how do you know if somebody is ready for surgery? And the second question I'll say is, have you ever said no to somebody? And if so, why?
Okay, that's very nice, very good question. So basically, as my experience, plastic surgery is not about for a medical only, like a physic only. Mostly the patient has some psychological problem. So sometimes as a plastic surgeon, I don't only treat a patient with their physics to change them, but go into their psychological needs. If we can see the problem, like for example, an excess skin, an excess fat, they struggle with that situation, that condition, that's the indication of the plastic surgery. But if they really have problem with their psychology, for example, they don't have any problem issue with physics, and then they keep asked to do the surgery. So there's some things that we need to
monitor.
Monitor. So for me, every procedure, it has their indication and contraindication. We need to do consultation, face-to-face consultation, a physical examination to determine need it or not. But if someone unhappy with their body, for example, they don't love themselves, sometimes we need to...
It's like an indication that there's more going on.
If I find that, for example, still have a good eyelid, for example, in a face surgery for facelift, sometimes they have still good eyelid. Maybe they ask me to, I want to do the upper eyelid surgery. In every procedure, even it's a very small and simple one, still have any risk and complication that possibly happen. So we need to make sure that the patient is really needed, and by the consultation or doing the physical examination. And the last is look up their psychological needs.
It's so interesting, and I think it shouldn't be overlooked. It really is important. And I think in this generation and in this society where there's like a huge wave of influencers, and there's lots of filters on people's photographs on Instagram feeds. So sometimes it's almost feeding this unrealistic look.
That's correct.
I'm sorry, I'm going to jump about a little bit, but I make this joke that once you have one cosmetic surgery procedure, you usually want more, because I say it's like decorating your house. You can't just do the one room, you have to do all the rooms. But you have to be in a very healthy mindset to know when is the right time to stop.
Yes, that's
like
correct.
You can't keep striving for this perfect look. Like we are going to age, but it, like you said at the beginning of your when you were talking, is when a lady or a man has reached a point where there's obvious signs of sagging, the neck has dropped, then they qualify.
Yes.
Like you see what they see, and actually it would be the right thing to advise a facelift.
Yes.
But if somebody come to you and they were, I don't know, let's say 25 and they wanted a facelift, what would you say?
Maybe if I don't see any problem, like theoretically at 25 years old, we still have very good skin laxity without any problem with aging. So what's the point of the surgery if you don't have those problems? It can cause more problem if you push me to do it, because like I said, in very small surgery, it still have a possibility to risk and complication. So, but sometimes in other case, because there's some genetics that in a younger age, they already have those problem like a sagginess, maybe because of lose weight or something like that. Yeah, and it's indicate for the surgery. Then why not? So that's why it's really important for meet the patient
and have a conversation
have a
with
conversation.
them. Yeah,
and know what they want, what they need. And back for what I said before, that plastic surgery is not about the perfection, it's only for improvement. So we cannot stop, for example, we cannot stop our aging process. Even we already have the facelift done, the aging still continue. So you cannot expect that after the facelift that you will become teenager again, for example.
Yeah, we don't freeze time.
That's what I'm talking. So, and also we need to be really realistic with the expectation of the patient, because nowadays, like you said, it's all on the social media and a lot of filters. And yeah, you guys need to be realistic, because we never know what's behind the camera, you know. Sometimes you look, the celebrity is very perfect, but we never know what's they've been through, maybe makeup on, the filters. So yeah,
I really love that. So you sound like you've got a very healthy approach with your doctor's practice. It's like, we keep you safe and we'll say no if it's not appropriate. Yeah. So most people already know that Patient Concierge Services doesn't just specialize in the aftercare. We specialize in the build up to surgery when they start getting really nervous, and then the during and the after. But then there's also a portion of the journey that isn't always talked about, and it's like the long-term aftercare. So let's say for the first 12 months post-surgery, what do you think that would look like for somebody having, say, a facelift, because that's the most popular one?
Yeah. So if it's come to the recovery, everybody is different, because a lot of factors that can relate it to the healing process. But if you do the surgery in the correct procedure, in a good hands, I think you don't have to worry about the recovery. And also, if you follow the doctor instruction, of course, a lot of external factor like if you're a smoker, for example, drinking alcohol, or you have underlying disease that can make the healing really hard to catch up, like for example, diabetes, high blood pressure, a cardio problem, or a hormonal imbalance. Sometimes it can be hard. But again, if we do a right pre-operative management, like we do a laboratorium check, we do a consultation, everything, examination, I think we can prevent that happen. So, and I think the most important thing is to be patient. Because you cannot compare yourself to others if it's come to the healing, because our body is very complex and a lot of factors can be related to the healing. So normally, for example, in a facelift, normally it takes about 3 months, the fastest 3 months to see the final result. And it also depends on your body. And if you're worried about something's happen, that's why for me, I really need your time in Bali at least to pass the emergency, emergency type, like the early complication that could happen in the early time.
So what would that be, like 2 to 3 weeks?
Yes, for example, maybe 10 days until 2 weeks. That's in facelift case. So if you're already passing those times without any problem, of course, that can be much better in the future. So that's why I believe that if you have any problem, we need to fix it before you fly back home. But if you're okay, last time we met and then there's no problem, of course, maybe some things that you are very worried about, that maybe just additional swelling because of the environment change, for something like that. So just be patient and free to us if you want to get an online consultation just to check.
Just like a follow-up,
After all, I am your surgeon, so better to contact with me.
Yes.
Yeah. Because if you get second opinion and maybe they don't know what the technique, and then it can be like very scary. Yeah, because
if they get the wrong advice.
Better to see your surgeon.
Get back in touch with the hospital, and then they'll speak to you. Yeah.
And then if there's something happen, like for example, if the late complication of facelift happened for like a nerve problem or something, asymmetry or irregularity, that we can fix that too. But after all, we the surgeon that know what exactly the technique and solving from the problem.
Would you say the inflammation response, obviously if they've had a facelift it can go in the face, but can they get inflammation in other parts of their body?
Of course.
So could that fluctuate for up to 3 months or more? Could it fluctuate for up to a year?
Yeah, that's correct, because when you have some part of your body that, for example, a wound on the part of your body, it has an immune response to the wound. So the immune response will change our hormonal, something like that. And then especially when it's a big fields and there's a lot of vital part, like for example in the face and neck we have lymph nodes, and then it's still ongoing of the healing process. Of course the other part of body will respond, but if you keep in healthy lifestyle, of course it will help.
It's going to keep the inflammation response down. So that would look like stop smoking, stop vaping, because everyone vapes these days, don't they? Ideally no alcohol for 3 months if possible.
For me, I think 2 weeks before and after is enough.
Okay.
Like I said, it's the more recent times.
It's when the body's going through the response to what it thinks it's had an injury. So it's responding accordingly. So then once that kind of response goes down, if they want a glass of wine with their meal after 2 weeks, it's okay.
That's okay, because also that's kind of like a drinking and smoking. Maybe it makes you feel relaxed. And then relax is good for your brain too. We cannot like push people too hard to not do any kind of things like that. But as long as you know that you are still in the healing process and it's bad for you, so it's not like you
don't have to permanently stop. You just need to stop for a certain period.
And you feel like it's very hard. It's okay. But for me, 2 weeks before and after is enough.
Are there any other tips that you can think of for supporting like major surgeries like facelifts, even like tummy tucks and stuff, such as, would it be good to have lymphatic drainage massages for a few months, or red light therapy, IV infusions? Like, would it be good to continue them for a few months?
Sure, of course. That's called a supportive therapy, and it's really necessary, and it's good, and a lot of research, a lot of articles are related to that. And then I think, why not, if we can boost the healing process? Of course. And my recommendation is, based on my experience too, I think after passing about a week, if it's come to the facelift, in a week after stitches removal, I think it's okay to start supporting therapy, because the wound is already closed properly. Sometimes the swelling almost calm down, the bruising and the pain, so you can start any kind of supporting therapy.
What's your opinion on hyperbaric oxygen chambers?
Oh, that's really good.
It's good,
the oxygen levels in the blood is good for boost healing. I have experienced bad wound healing, the necrosis skin, and I recommend to do the hyperbaric, and the result is fantastic.
Really?
It's starting to settle down and turn back the color.
That's awesome.
That's awesome. And a lot of freezes. It's not based on my practice. It's also
it's science. It's actual true. Fantastic. So for anyone that's watching, you need to have a nice healthy plan for at least 3 months, really. Supporting yourself with hydration, ideally stop smoking, stop drinking, high nutritional diet, anti-inflammatory foods, and if your budget allows it, continue with lymphatic drainage massages, maybe some hyperbaric oxygen chambers, and I guess good skin care routine and things like this. this? Good quality sleeping?
Yes.
Stress levels low? Part of patient concierge services is to find out who specialises in what. And a lot of the surgeons can do head to toe and do all of it. But I want to know about what you can do. So if I was looking at a menu, what would be on your menu?
Okay, just disclaimer. Sometimes people think plastic surgeon is like a god. We can do head to toe, but actually it's kind of hard to catch up for head to toe for the body. You need to be at least have a specialization in one part. For me, I think my favorite is a face.
Okay.
Like a facelift, anything for improve like eyelids, for example.
Do you do fat transfer to the face?
Not yet.
Okay.
I have a reason for that, but yeah, it's pro and cons,
okay.
but we'll catch it later. And the second is the breast, because why? For the face, because one, you see people, you see their face, right?
The brand.
Yeah. Yes.
Yeah.
And then for a woman, the breast is like a crown in the body. So I think 2-year experience in BIMC, after facelift, after breast surgery, mostly they're very satisfied if I did breast and then the face.
Okay.
So that's why
it's like the shoes match the handbag.
Yeah.
It's really good to talk about the breast for a little bit longer, just because so I'm 50 this year, and I had my first breast implants put in when I was 23. And back then, the fashion was to have big boobs.
Oh, yeah.
Whereas I think now the fashion is to have smaller boobs. I've noticed. And I know you shouldn't really think of boobs as fashion, but it is, you know. Maybe in like the 70s, it was fashionable to have a stick body, and now it's fashionable to have curves. So I've noticed a lot of women now are getting implants taken out, having a breast lift and going smaller. Have you noticed this?
Yeah, of course. Back again with, I think that's why I have like, that's principle about the harmony and balance.
Harmony and balance.
Yes, because if it's too much, it's not good, I think. Okay. So that's why maybe back in the day, they don't kind of think about that. So as long as it's big, it's really good. Or as long as, for example, if it's facelift, as long as it's very tight and it's young.
But it's not the case anymore.
For me, everything is better if it's balanced and harmony and natural. You ask me for very big one, and when I do examination and I think it's not matched for your body, maybe I'm really sorry, I cannot
say no,
yes.
which is good. I would rather you said no. And just so for any of the viewers that are watching, what is the difference between the implant going under the muscle and over the muscle mean?
Sure, because it's the technique for the pocket. So the breast implant surgery needs a pocket to put the implant.
Okay.
On top of the muscle, sometimes they good because it can fit the bigger implant. Because the muscle, it has a limitation for the size.
Okay.
But as you know, at top of the muscle, there's a lot of breast tissue.
Okay.
The breast tissue, when it meets implant, you know, implant is a foreign body still. Okay. Even it's a good quality right now.
There's always a risk of it being rejected.
Yes, because they put it on top of the muscle, very close to the breast tissue, the breast fit glands and everything. If it's come to the wrist, as I know, it's still higher. Okay. But if you ask for bigger boobs, for example, maybe a good option if you put top of the muscle. But if it's come to the under the muscle, of course, there's more safe because all of your breast tissue are covered by the muscle.
Oh, really? It's safer? I didn't know that.
Yeah. Because the implant itself will cover it by the muscle. And if it's come to the result, the more natural, of course, because it's almost like your original breast tissue.
So under the muscle, do you think is more natural?
Under the muscle.
Oh, really?
Under the muscle, it has
pros and cons.
For the muscle, of course, if we manipulate the muscle, we cut the muscle, if it's come to the healing process, it takes a longer time. Okay. Yeah, because our muscle is very active. If it's come to the pain, also more sore than the over the muscle. But I think regarding the risk and the complication in between, that's why I better choose
Go under, yeah.
Under, yeah.
And I don't know if this is something that you do or not, but I've also heard about a lot of people wanting fat transfer instead of an implant.
Yeah, yeah.
And my understanding is it's more high risk of the fat not surviving because there's so much movement.
Yes.
What's your opinion on that?
So that's why I said that until now I still don't do any fat transfer yet, because for me, maybe other surgeons will against me, but the fat is a good part of our body, of course. But if you really want it to make as a volume change, especially if it's a big amount, for example, the breast, if you want really good volume and projection, of course, fat, it still has a 50% of absorb, and then it won't last. Won't survive.
Yeah.
Even it's a very safe because it's your own body part. If it's come to the wrist, besides of the implant, of course. But sometimes it depends on your expectation. Again, if you expect like a very full and good projection, just go to the implant.
It's better to have the implant.
Yeah. Even you scare with the complication, the body rejects. There's still a lot of technique to prevent that. Yeah. And if it's that happen, it also can be treated.
Okay.
But if it's the fat, I think as my experience, most my patient that has the fat transfer is not satisfied as we use implant. So maybe that's the reason.
Yeah.
But it's different if it's come to the small part of the body, for example, like face. It's a very good option.
It's a better option. Yeah. Okay. Okay. Great. So we know you can do the facelift. We know you can do upper and lower blepharoplasty. We know you can do breast augmentation and an uplift.
Yes.
Yeah. Lip lift.
Lip lift, yes,
of course. Yeah.
Arms, yeah.
What's that called?
It's called a medical field. It's called a brachioplasty.
Brachioplasty. That's it. Yeah.
Or the commons is arm lift.
Arm lift.
Yeah, a lot of technique for the arm lift.
It's more popular now. I think there's so many people on like Wegovy and Ozempic.
Yes.
So they lose weight rapidly, and then they have a lot of loose skin.
That's correct.
So there's a lot more comments. Okay, so you can do the arms. I guess tummy tuck.
Yes.
Yeah. And thighs.
Yeah.
And body lift.
Body lift. Still thinking about it, because for the full lower body lift, you need a very, very big incision, like almost circumferential.
Yeah.
It's not my favorite because that takes a longer time for the healing. So I still need to see you in person. It's necessary or not for you, because sometimes people are not really needed because you still have a good back. Okay. And only need like a maybe extended tummy tuck, for example. So back again, we need to check.
Okay.
Yeah.
So your favorite is face and boobs.
Yes.
Yes. Okay. So we have a boob man, ladies. Can we have a quick chat about like people who want to have weight loss or weight loss surgery? So there's a big wave now, isn't there, of Wegovy, Ozempic, where the slimming injections, and then we see people losing weight quite rapidly over 12 months, and then they get the loose skin taken off. But what about somebody that doesn't want to do that, and they're really struggling to lose weight, and they still have somewhat of a large body, and they come to you and they say, I'd like to have just liposuction it all out and then do a tummy tuck. Would that be a bad or good option?
Okay, so yeah, that's another good question. So basically, if it's come to the plastic surgery, it's not about weight loss surgery. The weight loss surgery is mostly with the gastric, like a gastric sleeve, gastric bypass, something like that, or maybe with the medication like Ozempic, etc. But if it's come to the plastic surgery, it's more about the body contouring type of surgery. So if you already in the higher BMI, body mass index, and you come to me to ask, can I lose weight after I do liposuction, for example? Of course, the answer is no. The liposuction only help to remove the excess fat from the body and to contour your body. And there's an indication for each type of procedure. For example, tummy tuck. If you still have a high body mass index, it means that most of your fat tissue is inside of your organ. Our fat tissue is separate by two different parts, the visceral fat and the subcutaneous fat. So for the higher BMI, you still have a lot of visceral fat, which is inside of the organ that we cannot do nothing. So that's why the point is to make your body mass index lower or become normal at least. But if you already lose weight and the body mass index level is already normal, and if it comes to the problem with excess skin, and mostly if it's subcutaneous fat, of course, that's a good option for tummy tuck, for example, or liposuction.
So I think that's a really good piece of advice and guidance, because we see a lot of people coming to us, and I have seen some ladies have like 4 liters of fat taken out through like liposuction, but then they have like this loose skin. So it's I guess it's debatable of like when do you and when don't you. But I think the most healthiest approach from what I'm hearing is exercise, eat well, lose the weight, get your body mass index to a normal range, and then you can have liposuction for like the stubborn areas.
Yes, that's correct.
And the subcutaneous, is that the word?
Subcutaneous.
Like in the wall, in the wall of your body. And then once that's taken out, they can remove the excess skin.
Yes, that's correct. And even after the surgery, for example, after liposuction, after tummy tuck, you need to keep maintain condition. Sometimes patients like, oh, I really have a skinny torso now, and then I can continually eat, and they don't want to do exercise because of it's already perfect like that. So in 6 months or years, they come again they complain about the other additional fatty tissue. So the point is, it's only for improvement. So back on yourself to keep maintaining. Health is priority. That's correct. Great. So Dr. Indra, that was amazing. Thank you so much for all of your information and advice and expertise. And we will wrap up now, but can we just ask one more question for the viewers, for Patient Concierge Services, and also for the Facebook group called Facelift in Bali, which is founded by Pamela. There's 26,000 people in there at the moment. So it would be great if there's anybody from these groups who are curious about surgery, but really nervous. What would you say to them? Of course, first you need to do research. You need to do research. You need to choose your surgeon in a correct way, because now you have a lot of help like PCS. You can talk to you guys, have a good conversation, and if you already did research, and then choose your surgeon and make sure the surgeon is a qualified surgeon, board certified, and experienced, of course. If you already passing that moment and you meet the surgeon and do the consultation, this examination, pre-op practice check is really important. So I think it's very normal to feeling nervous to have surgery, because it's the thing that something can happen. But if you are in a good hand and they know what they're doing, of course they can minimize any risk. And back again, I believe that, like I said, you need to love yourself at the first time, because if you don't love yourself, even you go to a 100-year experienced surgeon, if you don't love yourself, you always feel unsatisfied. Like inadequate, like you just always want more. You feel like always feel nervous, always feel depressed, because at the end you need to love yourself. Love that. You need to love yourself, guys. Thank you very much.